I wish now to invite Governor Kuti of Isiolo, who has just joined us, to the podium and perhaps to talk on the county perspective and their response to COVID-19.
Thank you, CAS. Good evening. Mine is very brief. I think I want to share an experience of our first COVID case in Isiolo, which I think is going to be a lesson or a learning to other counties and how not to do certain things, because our first patient was exposed to a lot of embarrassment because his photos and the photos of his family, when we put them in quarantine, was taken and put on social media. And that has brought a lot of embarrassment to him and his family. And I think there was a lot of excitement and a lot of concern, because a first case in the county, everybody is very much attentive. But that was not how to do it, and we want to urge other counties, especially those who may be getting their first cases in future, to make sure that the privacy and the privacy of the patient and his family or their families should be of paramount importance, because nobody is free from getting COVID. We are all bound to get, even if we are governors or cabinet secretaries and anybody, media. This is a disease that anybody can get, and therefore the issue of stigmatizing those who have the disease, the issue of looking at them like they have a mistake or they have a problem different from other people, it should not be entertained in any county. And I would like to take this opportunity actually publicly to apologize to our patient and his family, and also to ensure that people refrain from publicizing the identity, putting the name, the ID number, the photos, taking photos maybe as samples are taken and then that is flashed on social media. That is very, very negative way of handling this disease. In fact, it's counterproductive to the way this disease should be managed. I think I'm also impressed now that more and more counties are getting well prepared. We are getting more isolation facilities. We are increasing our quarantine facilities. And I will urge that we continue, because our numbers are rising. And also the number of counties that are getting positive cases is expanding. It's like this thing is going to be spreading to all counties eventually. Therefore, it is important that we prepare ourselves, and those who are already preparing should continuously add the facilities, because the way it looks, we have managed to flatten the curve to a certain extent. But as maybe we open, and now that the eateries are open and maybe other places are being opened, then we need to be more prepared. The also issue of floods that are really compounding. Floods are compounding this problem. A lot of counties are now grappling with a lot of displaced communities, to some of them large numbers, who are displaced and therefore not having places to stay, and therefore they are crowding. They are not having ability to social distance because they have even nowhere to stay. I flew yesterday to a part of my county that has been flooded by River Wasonyiro breaking its banks, and the whole village was submerged. And it is important now we pay attention to that, and I hope now something could be done to prevent the ensuing diarrheal diseases, the ensuing dirty water that people are taking. So we may anticipate more malaria. Therefore, compounded with this condition, now we are having more challenges, and I'm urging counties to prepare themselves, and I'm also urging national government to really come in and support the counties that are grappling with these extra challenges. Thank you very much.